today's topic is, what is the best IBS treatment? In this video, I will show you the 3 important steps that you need to follow to find the best treatment that fits your needs for the perfect IBS treatment. But before we start, I just have to say that IBS treatment takes time. You have to be consistent and stay motivated. For those of you who are looking for a quick fix, then this video is not for you. So go somewhere else and look for some other crappy videos that promise you that you can fix your gut within 3 days or within a week. It's not going to be here. So, however, if you are looking for a treatment with a long-term effect or even looking to become IBS free, then this video is for you. So stay tuned. Step number 1. What type of IBS do you have? And what are your symptoms? So, do you, for instance, have IBS-C, which refers to IBS constipation, or IBS-D, which refers to IBS diarrhea? If so, what are the specific patterns of the symptoms? Is the stool watery or greasy? What is the color of the stool? So, do you experience blood in your stool? Or even, is the stool normal and your symptoms are something else? Do you experience bloating and flatulence? If so, what is the specific experience with the flatulence? Does it occur right away or after a meal? Or does it build up during the day? Do you look like a pregnant woman with a bloated belly? Or do you experience cramping and are you able to pass the gas? Do you have acid reflux? Could it be SIBO, the so-called small intestinal bacterial overgrowth? And what other symptoms do you have? Do you have chronic fatigue, eczema, allergies, stress, anxiety, sleep deprivation, etc.? So as you can see, there can be a lot of different symptoms that you need to consider, which could lead you to what the root cause could be behind your IBS symptoms. Step number 2, finding the root cause. Here I have to underline the importance of testing for the root cause. Here I would recommend a SIBO breath test and a stool test as a minimum. With the SIBO breath test, you can measure the levels of hydrogen and methane gas developing in your small intestine, which can help you clarify whether the problem is occurring in the small intestine. And the stool test can help you clarify which specific bacteria is overgrown, whether there is any signs of imbalanced gut flora, fungal overgrowth, parasites, or other gastric markers like inflammation, gluten sensitivities, etc., which all could lead you to what the root cause could be behind your IBS symptoms. Other important tests that you also could use could be a urine test for leaky gut or nutritional and metabolic function, and also a hormone test for hormonal imbalance and how this could relate to your gut issues. So as you can imagine, one thing is what you imagine the root cause behind your IBS symptoms could be, but another thing is what the tests tell you about what's actually going on in your gut. An example of misinterpretation could be that you are experiencing cramping in the lower part of your stomach, but the stool test tells you that you actually have an overgrowth of Helicobacter pylori, which typically is causing problems in the upper part of the digestive system. Another mistake could be that you are convincing yourself that the root cause behind your IBS struggle is food sensitivities towards red meats or dairy, and that these probably are causing your chronic diarrhea, when in fact, the stool and urine tests could be indicating that you have a leaky gut and that your gut lining is damaged, which pretty much makes you sensitive towards all types of foods because your gut lining is not able to absorb the nutrition from your diet and is causing inflammation and indigestion in the gut. So you need to find out what the root cause is behind your IBS symptoms. Could it be leaky gut, low stomach acid, gallbladder-related issues, stress-related issues, or something totally different? Step number 3, defining the best IBS treatment. So after you find the root cause behind your IBS symptoms, you can then develop the best treatment plan, which makes the plan much more efficient with long-term results compared to a quick fix treatment where you really have no idea what you are treating. So let's get more into the specifics. Let's say that you have a bacterial overgrowth. The best treatment could be to combine dietary changes together with herbal antimicrobials and probiotics. This is a two-phase-based process where the first step is to kill off the bad bacteria and the second step is to reintroduce all of the foods that you have eliminated and restore the gut flora. This process takes 8 to 12 weeks, although results can be seen within 4 weeks' time. Another example could be a leaky gut treatment. For such a treatment, I would go for a more long-term healthy diet, perhaps a ketogenic diet or an anti-inflammatory diet. I would also focus on repairing the gut lining with some natural remedies like bone broth, mucus-promoting supplements, and amino acids, etc. I would also go for some natural probiotics like fermented foods or milk kefir. Also some natural vitamins and minerals, supplementation, and perhaps also intermittent fasting. For acid reflux, I would also go for a more long-term healthy diet that is more carb restricted, perhaps including some apple cider vinegar to help balance the stomach pH. But I would also avoid foods that deplete the stomach acid, and I would recommend to stop frequent snacking and doing some intermittent fasting. So those are the 3 steps to achieving the best IBS treatment that meets your individual needs. There is no one size fits all in IBS treatments, so you need to figure out what the best treatment is for you using the 3-step method that I have presented you with in this video. If you are interested in topics like leaky gut or SIBO, then you should check out some of the other videos that I have posted on this channel where I talk more specific about these issues. And if you are benefiting from this content in any kind, then remember to click the subscribe button and I will update you on more topics related to IBS issues and treatment. Thanks for watching.